and welcome to English News Bulletin of Hallabol. Before moving to the details, let us have a look at the headlines of the day. Chief Minister Kumar Dev detailed the steps taken by the state government for uplifting Tripura's economy while declaring lockdown to be extended till 5 am of 4th August. Law Minister Ratul Nath briefed COVID-19 details as on Wednesday and greeted Muslims on upcoming Bakri Eid. Vehicle services remained paralyzed in the state on the third day of lockdown. Once again, allegations raised on the healthcare services at city's prime GB hospital. Now the news in details. Tripura Chief Minister Kumar Dev addressed the people of the state via social media, detailing the steps taken by the state government for uplifting the economy and condition of the people. He declared extension of lockdown till 4th August 5 am in the morning. Tripura Chief Minister Kumar Dev addressed the people of the state via social media. Thanking the people of the state for following the lockdown guidelines and norms, he said, though the people of various sections of the state are going through many hardships and economic losses, but as the Prime Minister Narendra Modi says, Jaan hai to jahan hai, the lockdown is essential in this crucial time. He further added, the state government has taken major projects to uplift the condition of the people, among which Swannirbhar Gram Swannirbhar Parivar is a major project taken for the rural areas. The government has also taken initiative to uplift the small-scale businessmen. He further added the state government is working in a way to uplift the economy of the state, majorly boosting the poor people to become self-reliant.
রাজ্য সরকার এই 7 দিনের প্রকল্প নিয়েছে। 7 দিনে প্রত্যেক বাড়িতে যাওয়ার সিদ্ধান্ত নিয়েছে। 2 দিনের যে ডেটা আমার কাছে রয়েছে 3,88,782টি পরিবারের কাছে যেতে আমরা সক্ষম হয়েছি, আর তার মধ্যে 9,855টি ব্যক্তিকে আমরা আইডেন্টিফাইড করেছি এবং 5,687 স্যাম্পল নিয়েছি এবং স্যাম্পল নিয়ে টেস্টিং করা হয়েছে এবং তার রেজাল্ট এসছে, আর তার রেজাল্টে 196 জন পজিটিভ এসছে। প্রায় 1/3 আমরা 2 দিনেই বাড়ি বাড়ি যাওয়ার আমরা যে কর্মযোগ্য নিয়েছে সেটা করতে সমর্থ হয়েছি।
Tripura Chief Minister described the initiative taken by the Health Department to conduct rapid house-to-house antigen tests for COVID that kick-started during the lockdown phase. Chief Minister Kumar Dev urged the people of the state to strictly maintain the guidelines of COVID-19, maintain social distancing, wear masks and keep proper care of own health, rejuvenating the body with vitamin C ingredients. Taking a note of the rising COVID cases in the state along with the rising death toll, Chief Minister Kumar Dev declared the state would extend lockdown till 4th August 5 am in the morning.
পর্যন্ত মানে 30, 31, 1, 2, 3, 4 তারিখ ভোর 5টা পর্যন্ত 4 তারিখ ভোর 5টা পর্যন্ত সম্পূর্ণ লকডাউন থাকবে। যেই বিধিনির্দেশগুলো রাজ্য সরকার লাগু করেছে সেগুলো লাগু থাকবে। যেখানে যেখানে রিল্যাক্সেশন রয়েছে সেগুলো রিল্যাক্সেশন থাকবে। ডিস্টেন্সিং এবং সাবধানতা, মাস্ক, এগুলোই আমাদের জীবনকে রক্ষা করবে। বন্ধুরা, আপনারা দেখেছেন যে এপ্রিলে ত্রিপুরাতে কোনো মৃত্যুর সংখ্যাই ছিল না, কিন্তু বাইরে থেকে আসার পর সেটা বড় মাত্রায় বেড়েছে।
He also added relaxations would remain as it is on healthcare services, ambulances, essential commodities and others according to government order. Any persons violating these measures would be liable to be proceeded against as per the provisions of section 51 to 60 of Disaster Management Act. Besides, legal action under section 188 of IPC. Bureau Report, Hallabol. Law Minister Rotul Nallat briefed the current COVID-19 situation in the state while declaring the extension of lockdown period in Tripura till 5 am in the morning of 4th August. Also expressed heartfelt greetings on Bakri Eid or Eid ul-Adha. While briefing the situation of COVID-19 as on Wednesday, Law Minister Rotul Nallat said number of people at facility quarantine are 222. 3,919 people are at home quarantine. Total sample collected is 1,51,033. Tests conducted so far is 1,49,664. Positive cases 4,288 and 2,678 people have recovered. Total death been 21.
রয়েছে 222, হোম কোয়ারেন্টাইনে রয়েছে 3,919। আমাদের স্যাম্পল কালেকশন টোটাল 1.5 লক্ষ পেরিয়ে গেছে, কিন্তু 1,51,033। টেস্ট 1,49,664, পজিটিভ 4,288, নেগেটিভ 1,45,376, রিকভার্ড 2,678, অ্যাক্টিভ মানে ট্রিটমেন্টে আছে 1,569, টোটাল ডেথ 21, পজিটিভিটি
Due to spread of COVID-19 in different parts of the state, which has posed a major threat to public health, hygiene and safety of the people, and it has been felt that unless stringent measures are put in place to contain the spread of pandemic to avoid the chance of large-scale spread of COVID-19 in population, lockdown was imposed from 25th of July 5 am to 30th of July 5 am. An intensive house-to-house survey was undertaken with effect from 27th of July 2020 to identify the suspected persons. But in review of the situation, it has been felt that total lockdown needs to be continued to combat the situation and break the transmission chain of COVID-19 pandemic in the state, said Law Minister Rotul Nallat. Therefore, direct extension of lockdown in the entire area of the state of Tripura for the period of 5 am of 30th of July to 5 am of 4th August 2020 has been declared.
এর মধ্যে আমাদের রাজ্যের মুখ্যমন্ত্রী অলরেডি ঘোষণা করে দিয়েছেন, তো আবার লকডাউন এক্সটেন্ড করা হলো। মাননীয় চিফ সেক্রেটারি, চেয়ারম্যান স্টেট অ্যান্ড এক্সিকিউটিভ কমিটি যিনি, উনি এটাকে এক্সটেন্ড করে দিয়েছেন আপ টু টুইসডে মর্নিং 5 am, মঙ্গলবার সকাল 5টা পর্যন্ত এই লকডাউন এক্সটেন্ড করা হলো। এবং রুলস রেগুলেশন যা আছে এজ ইট ইজ, যা রিল্যাক্সেশন আছে।
Taking a note on restoring biodiversity and ecosystem of state of Tripura, BJP government has taken the initiative in forming nurseries of seedlings in huge numbers. In the last cabinet meeting, decision has been made to sell polybag seedlings, 1 rupee polybag to private cultivators and free of cost to plant in government lands owned by both central and state governments, including the autonomous bodies. The government of Tripura has taken this decision in order to increase the number of plantation of trees and taking a note on improving Tripura's biodiversity.
গত মন্ত্রিসভার বৈঠকে রাজ্য সরকার একটা সিদ্ধান্ত গ্রহণ করেছে, সেল অফ পলিব্যাগ সিডলিংস 1 rupee per polybag to private land owners and free of cost for planting in the government land owned by both state government or central government, including autonomous bodies. রাজ্য সরকারের এবং কেন্দ্রীয় সরকারের
While declaring the extended lockdown, Law Minister Rotulal Nath further added the prohibited activities, exemptions and other details of the order dated 25th of July 2020 will remain in force. Bureau Report, Hallabol. The state entered last day of lockdown till amidst the 3 days of lockdown period declared by the state government. Apart from emergency services and requirements of essential commodities, whole Tripura remained paralyzed on Wednesday. The 3 days lockdown has fallen on third day, however, to be continued till Thursday 5 am counting the night curfew, which would continue even after withdrawal of lockdown from 9 pm to 5 am every day. Apart from emergency services and requirements of essential commodities, whole Tripura remained paralyzed on Wednesday due to total lockdown. Describing the situation to the media persons, police officials said, till now no hindrances have been recorded. People have sincerely responded to the lockdown, though office goers are allowed to freely transport, but checking is done for valid ID and passes.
যাচ্ছে অফিসে আপনারা দেখতে পাচ্ছেন, তবুও আমরা তাদের ডকুমেন্ট চেক করছি, ভ্যালিডিটি চেক করছি, যাদের সমস্ত কিছু ওকে আছে তাদেরকে আমরা অ্যালাউ করছি, আদারওয়াইজ আমরা তাদেরকে ঘুরিয়ে দিচ্ছি।
The lockdown in Tripura started from Monday 5 am is to be continued till 30th of July 5 am. Government and police urged the people to stay at home as much as possible. Vehicle services were crippled, but government's emergency services like hospitals, ambulances remained open without any pause. Public gave massive response to the lockdown and no gathering or crowd could be noticed. Bureau Report, Hallabol. Once again, allegations raised against the Health Department of Tripura under the ruling BJP government. This time, patient party complained on unavailability of free ambulance service and recklessness in the city's prime GB hospital. The ruling BJP government, which always stands tall with the so-called development, failed to provide quality health services in the hospitals. Repeatedly, various complaints have been raised by patients and patient parties for poor quality services and irresponsibility of the healthcare departments. Seeing the symptoms of COVID-19, a patient was taken to GB hospital for treatment on 27th of July in the morning by his daughter. Having fever and breathing problem, the old man was kept waited for long hours by the healthcare workers without conducting the COVID test or admitting the patient for treatment. So to get him admitted, his daughter ran to ILS hospital without any further delay and did the COVID test, where the patient was found positive to the virus. To transport the patient to GB hospital's COVID care center, the patient party repeatedly called 102 helpline number for an ambulance but did not get any response. Thereafter, taking an auto rickshaw, the patient was brought back to GB hospital to get admitted. The patient party was also made to sign the documents of the hospital. 28th of July, the patient died at around 9 am at night, but the hospital authorities took no initiative to inform the family members. On calling the hospital authorities at around 10:30 at night, the family members could find the information of death of their loved one. The hospital authority, however, replied it doesn't fall under their protocol to reveal the death information. Wednesday, after reaching the hospital, the patient party completed all the formalities but still were kept waiting for long hours without being provided the death certificate of the deceased COVID patient.
এসেছিল তখন তারপর আমার ওয়াইফ কি করলো, আমার শ্বশুরমশাইকে নিয়ে সঙ্গে সঙ্গে আইএলএসে চলে গেল। আইএলএসে গিয়ে তখন সঙ্গে সঙ্গে করোনা টেস্ট করলো। টেস্ট করলে তখন স্ট্যান্ড বাই রেজাল্ট আসে পজিটিভ। তখন সঙ্গে সঙ্গে ওখান থেকে তো আসতে হবে, এখানে তো ভর্তি হতে হবে। তখন অ্যাম্বুলেন্স পাচ্ছে না, কোনো পরিষেবাই পাচ্ছে না। 102 112 এইসব নম্বরে ফোন করছে, না আসতে পারবো না। কোনো টিভিতে খবরে যা দেখি আমরা তো অনেক সময় বিশ্বাস করি না, কিন্তু এখন তো আমরা বাস্তবটা পরিলক্ষিত করছি। যে সাংঘাতিক, কালকে 9:10 বোধহয় মারা গেছে। ওনারা তো ইনফর্ম করেননি, আমরা ফোন করে ওনাদের কাছ থেকে তারপর জানলাম যে উনি এক্সপায়ার হয়ে গেছে। ওনারা বললো আপনাদেরকে জানানো, এটা আমাদের প্রোটোকলে নেই, প্রোটোকলে নেই।
The patient party raised strong accusations on the poor quality health services at city's prime GB hospital. He alleged the reality of services can be seen only when one faces the system. Where the government boasts about high quality services, the scenario is completely opposite in reality.
পরিলক্ষিত হয়েছে একেবারেই পরিষেবা নেই, মুখে কিন্তু একটা আর বাস্তবে আরেকটা। বাস্তবে আমি বলবো জীবিতে কোনো পরিষেবাই নেই।
The question arises why the 102 free ambulance service, which is an emergency medical transport service, was not available to the COVID patient. Why the patient's test was not conducted at the GB hospital when he was suffering with fever and breathing problem. Why he had to go to the ILS hospitals for test. Also why the patient party was not informed about the death of their family member. While the people of the state are facing severe crisis due to the evil grasp of coronavirus pandemic, various complaints and allegations have come up against the Health Department of Tripura. A number of reports and incidents gives a clear picture showing that Tripura's Health Department is in doldrums in the ruling BJP period. The state lacks a health minister, lacks proper supervision and devoid of good healthcare services. And all this accumulates to the hardships that only the common man faces. Bureau Report, Hallabol. Well, that's all from our English desk at this moment. For more news and updates, stay tuned to Hallabol.